Welcome to our ninth and final talk of our current mini med school series. This talk is going to be on herbal supplements. My name is Drew Smith. I am one of the students in the UBC class of 2024, along with Julia and Nicole. So before I get into the talk, since we are at the end, I just want to briefly mention the certificates that we offer for attending the talks. I know this is something that's been offered in the past, and we're going to be offering it to you again. So if you do want to get a certificate from us for attending the talks, please send us out an email. And just email us basically saying that you want to get a certificate and also what name you would like to have put onto the certificate. So you can send us an email. We'll also be sending out an email later on. So if you do forget to send us an email, we will be sending an email about it later on. So look out for that. All right, so slides to advance. Here we go. So before moving on any further, I just like to do a territorial land acknowledgement. So I'm coming to you from Victoria here. So I'd like to acknowledge that I'm joining you from the traditional, ancestral, and unceded territory of the Lekwungen speaking peoples, including the Songhees, Esquimalt, and Wissanic peoples, whose historical relationships with the land continue to this day. As usual, we have our disclosure. So I am a medical student. These talks do not constitute for or substitute medical advice. This talk is going to be about herbal supplements, and I'm going to be talking about a number of common supplements, but as I'm sure you know, there's hundreds of herbal supplements out in the world, and so it's impossible for me to cover all of them. And even the ones I will be covering today, it's not possible for me to address all of the claims surrounding them, just because of the lack of research and evidence around herbal supplements. And of course, just time-wise, it would be impossible for me to address everything. This talk's not meant to be shaming people or discouraging people from using herbal supplements. I'm just going to be trying to provide some information. I do have some kind of points to make about certain things, but I'm definitely not going to be telling you not to be taking something, or to, again, I'm not going to be shaming you if you do use any of these herbal supplements I'm about to talk about. If you have any questions for yourself, for starting any herbal supplements, or you have questions about herbal supplements you're already taking, please do consult with your healthcare provider or a pharmacist, or sometimes it might be good to talk to a dietitian if you're interested in an herbal supplement for the purpose of replacing something in your diet that maybe you're not getting because you maybe have a bit of a restricted diet, say you're a vegetarian or vegan or something, and you want to take an herbal supplement to try to replace something that's missing from your diet.
So these are not opioid products, huh? Opium products, no.
Nope. So we're just going to be talking about herbal supplements. Yeah, and I'll have an outline soon on what we'll be talking about. And sorry, I did forget to mention at the beginning there, of course, we are recording this talk. So that will be available. This talk will be available on Dr. Gair's website later on today. And that the link to that website is in the email that we sent out to you that had the link for this Zoom session. So just giving an outline for the talk, I'm going to talk briefly about the background of supplements and the supplement industry. Won't spend too much time on that. Mainly going to be talking about several different herbal supplements. And then I just have a couple of slides at the end just to summarize the talk a little bit. All right, so giving a background, so dietary supplements, as I'm sure you all know, have been around for a very long time, hundreds, in some cases, thousands of years. And the herbal or botanical supplements are the ones that have been around and used for the longest time. So they've been used for hundreds or thousands of years in Chinese herbal medicine, indigenous medicine, and other traditional medicines around the world. Newer supplements that we have today include individual or combined vitamins, minerals, chemicals, or other molecules. And we also have probiotics as well. That is another category of supplements. There are some different terms you may have heard about supplements. So I have been mentioning dietary supplements as one term. In Canada, the more technical term is natural health products. In Australia, the technical term they use is complementary medicines. Another term you may have heard of is nutraceuticals, but this tends to be a bit more of a broader term that includes not just dietary supplements, but also other things. For example, foods that have added components to them, like fortified cereals. So you can get cereals that are fortified with different things like, vitamin B12 or D. You can get yogurt with probiotics in them. You can get margarine with phytosterols, which are specific types of fatty acids. So there's different things that are under the umbrella of nutraceuticals, not just dietary supplements. The supplement industry is a large one and is one that is continually growing. So in Canada, the health store industry is about a $4 billion industry that is continually growing. So it is a very large industry, but it's also a very poorly regulated industry. There's not nearly the same amount of rules and regulations around the testing and manufacturing of supplements compared to prescription medications. And so the manufacturing of the supplements tends not to be standardized in a lot of cases. So that could mean that if you buy, say, a bottle of supplements and there's a bunch of pills in them, each pill could actually have a slightly different amount of the supplement in them. So you're not necessarily always getting the same thing every time you take that supplement. On top of that, sometimes there can be things in the supplements that maybe aren't supposed to be in there. Some other chemicals or other things that just in the processing and creation of the supplements, there were some things that got left in that maybe aren't even on the bottle as something that would be in there. Just talking about the research in general around supplements, it's lacking in a lot of ways, and many of the things, a lot of which I'll be talking about today, is inconclusive. So unfortunately, there will be many points that I'll be having to say that the evidence is inconclusive or we don't know, and I'll be saying maybe a lot. So that's just a general problem with, again, the fact that it's not a very regulated industry. So there's not a whole lot that goes into researching these things beforehand. And then again, with the problems with the standardization, it's hard to do studies on supplements when the supplements you're providing to study participants isn't always going to be the same or giving the same effects because they're in different concentrations, or there's maybe other things included in them that you didn't know about. So it can be quite difficult to study these things. And so really, aside from vitamins and minerals, the long-term effects of most dietary supplements has not been studied. Vitamins and minerals do have quite a lot of a large amount of studying behind them. So vitamins and minerals, it just, for example, would be things like, of course, like vitamin A, vitamin B, vitamin C, D, and minerals would be things like iron or calcium, magnesium, those sorts of things. In terms of the prevalence or usage of supplements, as I'm sure you know, most people use at least one supplement. It really depends on what surveys or studies you're looking at as to what the prevalence of supplement usage is. It can range anywhere from 10 to 91% depending on the demographics of the population or how they're defining supplement usage in the study. In Canada, there was Stats Canada reported in 2015 that about 45% of Canadians greater than 1 year old used at least one supplement. And then these graphs on the right here are just showing some more information from from that Stats Canada 2015 survey, and just showing that a large proportion of the population uses supplements. BC residents are actually one of the highest users of supplements in the country. So why do we care? So we, as in myself, Julia, Nicole, Dr. Gair, all the other healthcare professionals. So why do we care about supplements? Why do we want to know about them? And also why would all of you and the rest of the general public want to know about supplements? Well, it's found in a lot of surveys that some people don't disclose supplement usage to their healthcare providers. It's a very common thing when we're interviewing patients and we ask about medication use, and they might say they're not taking anything. And then we ask about herbals or supplements, and then they'll give a big long list of all these supplements that they're taking, and that's totally fine. But sometimes we forget to ask and patients forget to tell us. Or maybe they don't know it's important to tell us. And then that can be harmful because there are harmful interactions that can happen between prescription medications and over-the-counter medications or herbal supplements or other supplements as well. So it's good for us to sort of know about usage of supplements and being able to know what harmful interactions could be possible. As well, it's good for us to know about supplements because we do know that there are a lot of supplements that are quite beneficial. We prescribe supplements quite regularly. So just a couple of examples I put there: iron and folate or folic acid are just a couple of supplements that are routinely prescribed by doctors. So there's several different categories of supplements: vitamins, minerals, as I've mentioned before, the botanicals and herbals, which is what I'm going to be focusing on today. Of course, can't go through all of them, but I've just selected several very common ones. There's also fatty acids, protein and amino acids, other chemicals, and then probiotics and prebiotics. So those are all interesting things. It would be, I could probably do a big talk on all of those categories, but I've selected to talk about botanicals and herbals here. So this is just the breakdown of the herbal supplements I'm going to be talking about today. I'm sure there's many others that you know of that you maybe would have liked me to talk about today. I've just simply picked some of the most common ones based off of some surveys and studies I looked at that were trying to look and see what are the most common supplements that are used. And so these were some of the most common herbal supplements. But of course, I'm sure there's many other ones that you know of, but I just don't have time to talk about all of them. So these are the ones I'll be talking about today. Before we move on any further, we'll have a first quiz question here. So I'll get the poll started here. All right, so you should be able to enter your response there. So which part of the turmeric and ginger plants is used for culinary and medicinal purposes? Is it the flower? Is it the leaves, the stem, or the rhizome? I'll just give you a moment to respond. All right. Almost all of you have responded. Okay. So I'll share the results there. All right. So most of you said the rhizome. Few people saying the other ones there. So the answer here is, if I can get my slides, there we go. So the answer here is the rhizome, which is the underground root part of the turmeric and ginger plants. All right, so starting with turmeric is our first one here. So this is the rhizome that I was just talking about there. So another common name for turmeric is called Indian saffron. It's part of the ginger family, and it's native to Southeast Asia. So again, the rhizome or the underground root is the part that's used in traditional medicines, as well as a culinary spice, as you probably know. And it's been used traditionally in both Indian and Chinese medicine. So the part of turmeric that's thought to be sort of the active chemical substances are called curcuminoids, and the most common curcuminoid is curcumin. So you may have heard of curcumin as well. So this bottle here is labeled turmeric curcumin. So curcumin is just the main curcuminoid in turmeric. So what we believe to be the main active ingredient in turmeric. And it's actually also what gives it its yellow-orange color. And when it comes to using turmeric as a supplement, it can either be, you can either use the dried out rhizome, or you can actually make it into a paste that can be used for skin conditions. There's many different and very varied uses or claims to what turmeric can be helpful for. So these are just some of them. So there's claims about being useful for arthritis, digestive disorders, respiratory infections, allergies, liver disease, depression, and many other things. And then of course, it's also used as a spice and a main ingredient in curry powder. The problem is that we really don't know a whole lot about turmeric in terms of its actual usefulness and whether or not it can actually be beneficial for any of those things. The main problem is that that main curcuminoid curcumin is very unstable, which means that basically it will quickly react and change into other molecules. So it's hard to study curcumin, and when people take curcumin as a supplement, it doesn't seem to get absorbed into the bloodstream very well. So if you are trying to study it, it can just be very hard to know how much curcumin is getting into the body and what kind of effects it could be causing. And so it's just very hard for us to know what or if curcumin really is doing the things that it's claimed to be doing. And again, there's this lack of standardization in the manufacturing of the products for turmeric and curcumin. So when we're doing these studies, we could be giving people tablets from the same bottle, but everybody could be getting slightly different amounts of the turmeric or curcumin. So unfortunately, we really don't know a lot about turmeric. In terms of safety, it's generally considered to be safe. Of course, it is used as a culinary spice, so there are many people who consume it on a regular basis. So generally, it's considered to be safe. One thing that's been noted is that it might reduce blood sugar levels in the body. So if you are mixing it with diabetic medications, you could be at a bit of a higher risk for hypoglycemia. I've just got a picture here of some of the symptoms of hypoglycemia. And in terms of pregnancy and breastfeeding, if you are supplementing beyond what is normally consumed in a diet of someone who does regularly consume turmeric, it may be unsafe in pregnancy, and it's not really known if it's safe in breastfeeding. So again, in general, not a whole lot is, unfortunately, not a whole lot is known about turmeric. All right, so moving on to apple cider vinegar. This is actually kind of an interesting one to me to see that was so high up on the list of herbal supplements. So apple cider vinegar, so vinegar made from fermented juice of apples. Acetic acid is the main component of vinegar. That's what's thought to be responsible for the health benefits. Some of the current uses or claims around using apple cider vinegar are for appetite control and weight loss, lowering blood sugar and cholesterol levels, for digestive health, and to boost the immune system. In terms of the current research, there's really no evidence around its effectiveness or safety as a supplement. But as a food, so if you're just using apple cider vinegar in your cooking or preparation of other foods, there has been studies that have found it might improve blood sugar levels and insulin response in diabetic patients, as well as improve cholesterol levels and weight loss in obese individuals. But all of this is quite low quality evidence. And as I said there's really no evidence around the effectiveness or safety of apple cider vinegar as a supplement. So if you were taking it in some sort of like a tablet that was as a supplement from a health food store. In terms of safety or interactions, household apple cider vinegar is generally considered to be safe. Again, people do use this stuff in their regular cooking or food preparation. So it's generally considered to be safe if you're using it in those smaller amounts. It can cause low potassium, skin irritation, chemical burns, or tooth erosion. Again, it's acetic acid, so it is acidic. That's just a photo here just showing some tooth erosion from acid erosion of the enamel. However, with apple cider vinegar supplements, it has been found when people have studied and looked at the actual supplements that sometimes the acidity levels are 10 times the amount of regular apple cider vinegar. And so that kind of doesn't sound like a great thing. That's kind of getting to kind of too high of levels of acidity. But unfortunately, again, there's just not really much in the way of studies around apple cider vinegar. So no one's really assessed whether that is unsafe or not. But it is potentially unsafe. All right, moving on to green tea. So I've got another poll here. I'll get that activated. All right, so the question here is true or false. Green tea, black tea, and oolong tea come from different species of the genus Camellia, which is the plant genus. Give you guys a little bit more time to respond. All right, I'll end the poll and share. Okay, so pretty close here. 9 people saying false, 6 people saying true. So let's see. Answer is here. It's actually false. Green tea, black tea, and oolong teas actually all come from the exact same plant. It's just the preparation of the plant is slightly different to produce the different teas. So green tea has been used for medicinal purposes in China and Japan for thousands of years. And we do know that green tea contains these antioxidant components called catechins. So antioxidants, I'm sure you've heard of them many times, and on TV and on the internet and through friends and family about how good antioxidants are for you. So basically, antioxidants are these chemicals that basically help protect our body from certain products of metabolism in our body. So under just normal circumstances of metabolism in our body, we produce certain things that we call free radicals or reactive oxygen species that can damage our tissues. And basically antioxidants just help sort of deal with those things and prevent them from damaging our body. So green tea does contain antioxidants in them in the form of these catechin molecules. So right there, that sounds pretty good that they have these components in them. In terms of the current uses or claims around green tea, it's said to be able to improve mental alertness, help with digestive symptoms and headaches, assist with weight loss. And there's also some research that's looking into whether green tea has any effects of protecting us from heart disease or helping reduce cancer risk. There is actually a prescription medication that contains green tea extract, and it's this medication called Verigen. And as you can see in brackets, it says syn catechin, so it's got some of the catechin antioxidants. One version of them in this. And this is a medication that's been approved by Health Canada for the treatment of genital warts. So I won't be talking any more about that, more just focusing on the herbal supplements, but I thought it was interesting that there is an actual approved medication that includes a green tea extract. So the research around it right now, in terms of that improved mental alertness, it's right now thought that that's probably just due to the fact that there's caffeine in green tea. When there has been studies of the main catechin in green tea called epigallocatechin 3 gallate, or EGCG, it was found that this molecule alone did not seem to improve mental alertness. So again, it's probably just the caffeine that's in green tea that's leading to increased mental alertness. In terms of the research around whether or not green tea can reduce cancer risk, it's really inconclusive right now. There's some things that show maybe, and there's some things that show there's nothing. So we really don't know about that. There needs to be more research around that. In terms of reducing heart disease risk, this actually might be true. There is some evidence to show that that green tea extract can decrease blood pressure and cholesterol levels, which are risk factors. Having high blood pressure and high cholesterol levels are risk factors for heart disease. So by reducing that, they could be helping reduce the risk of heart disease. More study is needed, but that's a potential thing. In terms of weight loss, it hasn't been found to be helpful. And in terms of those other claims of helping with digestive symptoms and headaches, it's simply just not known right now. There just really isn't any good study or evidence information about that. In terms of safety and interactions, drinking up to 8 cups per day of green tea is believed to be safe. And if you're drinking up to 6 cups a day or no more than 300 milligrams of caffeine while being pregnant or breastfeeding, that might be safe, but drinking any more than that could be unsafe. And part of this risk here with green tea and pregnancy is that it's been found that green tea seems to decrease levels of folic acid, which is a vitamin that's very important for proper development of a fetus. And it's definitely something that is recommended for people to be taking prior to and during pregnancy. So if green tea does reduce the absorption of folic acid, then that could lead to birth defects. So that's a potential risk of consuming large amounts of green tea while pregnant. And then also just noting that caffeine does pass into breast milk. So if you are drinking large amounts of green tea while breastfeeding, then you could get quite a fussy and hard to calm down baby if you're drinking large amounts of green tea. One other thing is that there's been some case reports of green tea extract affecting the liver. This isn't common, but of course a very important thing to know about, an important risk. And so if it does damage the liver, you'll get symptoms such as abdominal pain, you'll get dark urine, jaundice, and there's actually been some instances of over-the-counter weight loss medications that included green tea extract that also cause this in very rare cases. So if you are taking green tea extract, it's just important to be mindful. If you do experience any of these symptoms, then definitely speak with a healthcare professional. Of course, if it's very severe, then you should go to the hospital, but definitely something to be aware of. Some more things here. So it has been found that green tea extract may reduce the blood levels and effectiveness of certain medications. So digoxin is a medication that's typically used for treating heart failure. Lisinopril is an ACE inhibitor and a medication that helps reduce blood pressure, among other things. And then Nadolol, which is another blood pressure medication. It's used for other things for the heart as well. So green tea extract can reduce levels of those and therefore reduce their effectiveness, which of course is not a great thing if you're really needing to be taking those medications. And then it may also increase certain levels of certain medications. So simvastatin is a statin medication or something that helps control your cholesterol levels. If it increases levels of simvastatin, this increases risk of liver damage and another condition called rhabdomyolysis, which is basically breakdown of your muscle. And if you have rhabdomyolysis, this can damage your kidneys. So that's quite an important risk of green tea extract. And then there's another increase of a medication called Tacrolimus. This has many side effects. Tacrolimus is a medication that's used for preventing rejection of organs when you've had an organ transplant, and increasing levels of it has many, many negative effects. So there's a lot of bad stuff that can happen with that. One final thing, and this is a bit, I think, from when I was reading, a newer discovery, something that still needs a bit more research around, but it's found that it might interfere with this specific chemotherapy agent called bortezomib. So that's a bit of a newer one that I saw. So there's a little bit more studying that needs to be done around that. So there are definitely several different things to be aware of if you are on any of these medications to know about. And again, that's why it's important to speak with a healthcare professional when you are thinking of starting on any herbal supplements. All right, moving on to aloe vera. So aloe vera, as you probably know, it's a cactus-like plant that grows in subtropical regions. So if you go down, say, to the southwestern United States, you'll probably find aloe vera growing out in the desert. Can be used both topically and orally, and there's two different parts of aloe leaf extract. So if you hear aloe leaf extract, that's kind of just more generally talking about using parts of aloe vera, but the two specific parts are the aloe gel and the aloe latex. So the aloe gel is just the clear gel part of the aloe vera, and then the aloe latex is kind of just underneath the outer portion of the aloe vera leaves, is this kind of what they call sort of this yellow latex. And so that's something else that you can use as a supplement. So there's a whole bunch of different uses of aloe vera. In terms of topical uses, it's been used for things like acne, lichen planus. So this picture here is just showing some acne. This is lichen planus, a type of skin rash. Oral submucous fibrosis. This was actually something I'd never heard of when I was looking at it, but apparently it's sort of a buildup of scar tissue and the submucus of the oral cavity that can, if it progresses quite a lot, it can actually cause a lot of problems with being able to open and close your mouth. Burning mouth syndrome, another thing I hadn't heard of. Essentially, burning mouth syndrome, from what I read, seems to be something where you burn the inside of your mouth, but there's no apparent reason for it. So, you know, if you drink something really hot and you burn the inside of your mouth, you know why you burned it. Burning mouth syndrome seems to be you burn the inside of your mouth, but there is no apparent reason as to why you burned the inside of your mouth. It's also been used topically for burns, as well as radiation-induced skin toxicity. So say someone gets radiation therapy for a cancer, that can cause a reaction on the skin. And so apparently aloe vera has been used to help with that. In terms of oral uses, it's been used for things like weight loss, diabetes, hepatitis, or inflammation of the liver, as well as inflammatory bowel disease. So Crohn's disease and ulcerative colitis are examples of inflammatory bowel diseases, and there's other conditions as well. In terms of the research, so for acne, aloe vera might help for acne, but it's been found that it's more helpful when it's combined with medical soaps and tretinoin gel, which is something that's also used for acne. So that's more of another prescription that you can get for acne. So may be helpful, but it's also need to be used with these other things. So whether or not the aloe vera is really that much helpful, or if it's more just those other two things that are helping, not really sure. In terms of burns, it has been found that aloe vera might help speed up the healing process and also reduce the pain of burns. There's also some other skin conditions that aloe vera has been found to maybe be helpful for, such as herpes simplex, which is this photo here, psoriasis, which is this one here, and then lichen planus, as I mentioned on the previous slide. It's also been found that it might be helpful for ulcerative colitis, which is one of those inflammatory bowel diseases. There's been some other research around things such as irritable bowel syndrome, diabetic foot ulcers, and dental plaques, but right now that research is inconclusive. In terms of safety and interactions, generally aloe vera is considered to be safe, but there are some potential interactions that I'll be talking about on the next slide. In terms of potential problems with topical use, there have been cases of having a bit of burning, itching, or eczema on the areas that you apply the aloe vera to. Also, it's been found that if you are consuming aloe leaf extract, so that would be both the gel and the aloe latex, is associated with cases of acute hepatitis. So again, inflammation of the liver. And it might also be unsafe in pregnancy and breastfeeding to be consuming aloe leaf extract. In terms of consumption of just the aloe latex, there's some specific things associated with that. So abdominal pain and cramps are some symptoms that people have reported. As well, overuse of aloe latex seems to increase the risk of adverse events with digoxin. Again, digoxin, I mentioned before, is a heart medication used to treat heart failure. And the problem here is that digoxin has a side effect of reducing potassium levels, and the aloe latex also seems to have a problem of reducing potassium levels. So if you combine these things, then you can really reduce potassium levels, and that can have severe effects on your body, especially for things like your heart function. In terms of the aloe gel consumption, it's found that it might increase the risk of hypoglycemia when you're mixing it with the use of diabetic medications. All right, so we're at the break here. So it is 1:41. So we will come back here at 1:51. If you have any questions, you can pop them into the chat at this time, and I'll try to take a look at them and answer them when we come back from the break. So we'll take 10 minutes and I'll see you at 1:51. So it's 1:51. So we'll get going again. I'm just checking the chat here to look at any questions. So who regulates the health products industry? Why is it not Health Canada? Okay, so it is Health Canada. Health Canada does regulate natural health products, but a couple of things, it's not regulated the same way that drugs are regulated, like prescription medications are regulated. So there's just not the same amount of scrutiny that comes around in terms of safety and efficacy. Health Canada does try to make sure that the products they approve, and I'll talk about this at the end, there's specific labeling that gets put on natural health products that have been approved by Health Canada. So definitely, if you are going to get any supplements, you should look to make sure that there is that labeling that says it has been approved by Health Canada, but this is not to the same extent. And then of course, the other issue is that you can get supplements that haven't been approved by Health Canada. Now, I'm pretty sure that's not technically legal to sell supplements or natural health products that haven't been approved by Health Canada, but of course it happens, and people are able to purchase supplements that haven't been approved. So yeah, so it is regulated by Health Canada, but it's just not regulated to the same extent that prescription medications are regulated. I hope that answers your question. Okay, so black tea originating in China. Okay, I'm not sure about that in terms of the black tea. I'm as far as I know, I'm pretty sure the Camellia sinensis that I described when I was talking about green tea, that plant is what both green tea, black tea, and oolong teas come from. And Camellia sinensis is a source of coffee. I think it's a different genus of plant species that coffee comes from. I could be wrong on that. I would probably want to look it up again afterwards, but I'm pretty sure the Camellia sinensis is what green tea, black tea, and oolong tea comes from, and coffee is a different genus, not Camellia. It's something else. I don't know the name. Probably something related to coffee something. I don't know. Don't know the Latin name, but I think it's something different. Ayurveda is used in India. Are these my bugs? Yeah, I think, it's an important point to mention about holistic medicine. Certainly for myself and Julia and Nicole, we've had talks about, making sure that patients who do use traditional medicines to try to accommodate for that as best as we can. Of course, we always want to make sure we're not prescribing something that's going to negatively interact with something that they're taking as part of holistic medicines, or as part of their supplemental traditional medicines that they're taking. So it's certainly something we want to try to make sure that we're having a holistic approach to our treatment with patients, for sure. That's all the questions I see. I did see someone did the raise their hand thing. I honestly don't know how to now look and see who raised their hand. So if someone did raise their hand, use the raise hand function. If you have a question, you can either turn your mic on or type into the chat. All right. Oh, I see something.
I know a question. This is Raj calling, Dr. Prasad. If it is not part of the holistic medicine, why there is so much emphasis on these herbal medicines then? I mean, to what extent it supplements the allelopathy, how much do you use, in the Western medicine?
Oh, how much do we, like how much would a doctor prescribe these sorts of things? Is that what you're, yeah, I mean, personally, I don't know the full answer to that, but typically in terms of herbal supplements, like the things I'm talking about, these typically aren't things that we would prescribe. It more tends to be the case that if we had a patient that, say, was taking these things by their own choice, or if it's part of their own traditional medicines that they use, we would just like to work with them in terms of, again, wanting to make sure we don't prescribe something that's going to negatively interact. But we personally, we wouldn't be prescribing these things.
Because, a lot of pharmaceuticals, a lot of medicines are derived from botanicals like aspirin, but they are very widely used in the allelopathy.
Yeah, that's a great question. Yeah, again, in terms of what we do as doctors, we typically aren't prescribing these herbal supplements.
And because are they mostly synthetic chemical, or originally they are derived from plant products? Most of these medicines that we use in allelopathy.
Sorry, could you just repeat what the question is?
Most of these synthetic medicines, that you prescribe to us, what is their source of origin? Are they really derived from plant products and cleaned it up, and only the active principle is you use the active principle and discard the rest of the byproducts, in the plant? Are they synthetic molecules?
Yeah, actually, Dr. Gair is just typing to the chat here, making some good points. Yeah, so certainly, a lot of medications do originate from things that have been used in the past. I'm trying to remember is it, trying to remember what aspirin comes from, but aspirin does come from a specific, I think a tree bark. And it was just, that was used as medication in traditional medicines as I think a tea. And then we were able to sort of isolate what was actually working. And then we were able to produce aspirin from. So certainly lots of medications do originate from this. But the thing is that, as you mentioned, prescription medications, we're isolating the specific thing we want to use. We're not using the whole plant product where there's many, many different things in there, some of which we don't even know about. And there's just way more research that goes into making sure that prescription medications are doing the things that we want them to do, and trying to watch out for things that are negative and try to limit those things. So there's just a lot more research that goes into it, but certainly related.
For instance, aspirin comes from the willow tree, salix,
willow bark. Yeah, that's right. Yeah.
Salicylic acid, and Bayer has a patent. They made millions of dollars by isolating and refining the chemical structure.
Yeah.
So I mean, and on the other hand, you have to chew up a lot of bark of salix plant, willow plant before you get the effect. But these refined chemical medicines like the Bayer's, it's very easily, it's far more effective because that's the active principle,
Yeah. So all right. Liz is urging me on to continue the talk. So yeah, we'll get going here. We'll keep moving on, but thank you for all your questions there. All right, so the next thing we're going to be talking about is garlic. So garlic, as I'm sure you know, it's an edible bulb from a plant in the lily family. It's traditionally been used by the Egyptians, Babylonians, Greeks, Romans, Chinese, and Japanese. So for thousands of years, and it can be used both orally and topically. Some of the current uses or claims around garlic as a supplement is in reducing blood pressure, cholesterol levels. There's some questions around whether it's able to reduce the risk of gastric cancers, and as well lowering blood sugar levels. And then in terms of its topical use as well as oral use, there's some studies around whether or not it can be used as an antimicrobial. So right now, the current evidence seems to show that garlic might be helpful in lowering total cholesterol and LDL cholesterol, which is our bad cholesterol, as well as lowering blood pressure. But it doesn't seem to be helpful on increasing levels of HDL cholesterol, which is our good cholesterol, affecting triglyceride levels or lowering blood sugar levels. So some evidence to show that it could be helpful in reducing some risk factors for heart disease. In terms of gastric cancer, it has been found that eating high levels of vegetables in the garlic family, so garlic as well as onions, shallots, chives, and leeks, might reduce the risk. But when it's been studied, when just garlic alone has been studied for this, it hasn't been found to reduce the risk of gastric cancer. So it seems more eating high levels of a variety of vegetables in the garlic family might have some sort of effect. And then in terms of the antimicrobial use, it's also been thought maybe it can help with the common cold, as many things are. That's inconclusive. In terms of safety and interactions with garlic, it has been found that garlic might increase the risk of bleeding. So it's important to try to not combine garlic supplementation with blood thinners. So if you're on things like warfarin or a direct oral anticoagulant like apixaban, or you're on aspirin, or if you need to have some sort of surgery, you should either stop taking garlic supplements or just speak with a healthcare provider and determine whether or not it is safe for you to be taking garlic supplements. Another important interaction is that garlic supplements might interfere with the effectiveness of some HIV medications, which of course that's quite a serious thing if it is interfering with their effectiveness. So that's another thing to look out for. In terms of the safety generally in pregnancy and breastfeeding, it's unknown whether garlic supplements are safe, whether you're using orally or topically. Side effects, you probably know about some of these already. Breath and body odor, heartburn, and an upset stomach are the main side effects. And some people do experience allergic reactions, especially if you use them, use garlic supplementation topically. There can be allergic reactions with some people. So moving on to ginger now. So ginger is native to China, Japan, and India and other parts of Asia. It's a spice that comes from, or the spice comes from the rhizome of the plant. So as we mentioned with one of the quiz questions at the start of the talk, it's again the rhizome, just like turmeric is what we use. It's been used in China for a very long time, as well as India and Japan. It's been used in their medicine since at least the 1500s. The current uses or claims around the use of ginger, there's various causes of nausea and vomiting that it's been said that ginger has been helpful for. And it's also been believed that it might be helpful for menstrual cramps. Current evidence for mild nausea and vomiting in relation to pregnancy and for menstrual cramps, it's been found that ginger might be helpful for those things, but it hasn't been found to be helpful for motion sickness. For nausea and vomiting related to cancer chemotherapy, it's been found that taking ginger on its own doesn't seem to be helpful, but if you're combining it when you're taking the chemotherapy medications, or if you're combining it with other medications that are used to prevent nausea and vomiting, there does seem to be some benefit there. And then with post-operative nausea and vomiting, that's inconclusive right now. There's also been some studies around whether or not ginger can help with the symptoms of knee osteoarthritis, but that's also been inconclusive. So in terms of safety and interactions, generally ginger is considered to be safe, right? It's quite a common thing that people do use and consume, but it has been found that it may increase blood levels and side effects of morphine. So this does create the potential for overdose of morphine. So I've got an image here just showing the signs of opioid overdose. But the main sort of the really big things that we worry about with increasing levels and side effects of morphine are things such as respiratory distress, profound sedation, eventually leading into coma and potentially death. So that could be quite a severe interaction between ginger and morphine. So need to be careful about that. There's also been some rare cases of increased bleeding with ginger. So again, just being aware if you're on a blood thinner, and again, probably should speak to a healthcare professional if you are considering taking ginger supplements. General side effects with ginger include abdominal discomfort, heartburn, diarrhea, and mouth and throat irritation. And these last two are more severe if you're consuming very large amounts of ginger. In terms of safety during pregnancy, that's inconclusive, and the safety while breastfeeding is not known at this point. All right, so moving on to St. John's wort. So we have another poll here, so I'll get that up. All right, so which of the following is not another name for St. John's wort? Is it goatweed, Klamath weed, maidenhair, or hypericum? All right, I'll give a few more seconds here. All right, I'll end it there. Here are the results. Okay, so we got a mix of answers there. So Maidenhair had the most selections though, and that is the correct answer. So goatweed, klamathweed, and hypericum are all different names for St. John's wort. Maidenhair is not. It's actually another name for the next, the last herbal supplement I'll be talking about, which is ginkgo. But we'll talk about St. John's wort here first. So again, those are the other common names for St. John's wort. It's traditionally been used in Europe since the ancient Greeks, and supposedly it's named after St. John the Baptist, which I thought was interesting. The current uses and claims, the main one is for depression, and that's something that you maybe have heard of. Other current uses and claims are for menopausal symptoms, attention deficit hyperactivity disorder or ADHD, somatic symptom disorder. So somatic symptom disorder, maybe you haven't heard of it. It tends to be a condition where people greatly exaggerate or get very paranoid about symptoms in their body. So they could have very minor symptoms, but get very worried about them or over exaggerate the severity of them or the implications of the symptoms that they might be having. Obsessive compulsive disorder and many others. And topically, St. John's wort has been claimed to be helpful for wounds, bruises, and muscle pain. So again, looking at depression, since this is the sort of the main claim, it actually has been found that St. John's wort is more effective than a placebo. So placebo being, say, like a sugar pill, something that's not really supposed to have any effect. And it's been found to be as effective as antidepressants in the short term for mild to moderate depression. And short term here is usually referring to less than 12 weeks. And again, only for mild to moderate depression. Currently, it's unknown if St. John's wort is effective for severe depression or if it's effective for more than 12 weeks. There are thoughts, though, that it might cause less side effects than antidepressants. So that's one other reason why people might want to try to take St. John's wort over an antidepressant for mild to moderate depression. In terms of menopausal symptoms, wound healing, and somatic symptom disorder, St. John's wort might be helpful. For irritable bowel syndrome, chronic hepatitis C infection, HIV infection, and social anxiety disorder, it has been found that St. John's wort is not helpful for any of those things. And there's some other questions around smoking cessation, memory improvement, anxiety, ADHD, and seasonal affective disorder. But right now, we really just don't know. There's not really any research that's been done around those things. In terms of safety and interactions, when being used short-term for mild, moderate depression, it's generally considered to be safe. But there are many drug interactions between St. John's wort and other medications. So I'll talk about some of those things now. Or actually, before I get that, I'll just briefly talk about why St. John's wort seems to interact with a lot of medications. And this is because St. John's wort interacts with a couple of different processes in the body. This is actually something that Julia talked about in her previous talk on drug interactions. So I'll just briefly talk about this here. So St. John's wort is an inducer of a transporter in the body called P-glycoprotein. So I just have a small picture here. So this is something that's found in multiple areas of the body, but in terms of absorption of drugs, we're more focusing on the intestines or the GI system. And basically what P-glycoprotein can do is, say, this kind of white space here is is sort of the interior of your intestinal tract. If you have something that gets absorbed into the cells, the lining of your intestinal tract, P-glycoprotein can then pump that back out into the intestinal tract. And then of course that would keep moving on and eventually be excreted. So since St. John's wort is an inducer or sort of an activator of P-glycoprotein, it can decrease the absorption of certain medications or drugs that can be affected by P-glycoprotein. Also, St. John's wort is an inducer of cytochrome P450 enzymes. These are enzymes in the liver that do many different things in terms of metabolism and breakdown of certain drugs. And so since it's, again, an inducer or sort of an activator of certain P450 enzymes, it will increase the breakdown of certain drugs. So taken together, it can basically decrease absorption of certain drugs as well as increase the breakdown of certain drugs in the body. And so essentially, if you're taking a drug that's affected by these things, it can really decrease its effectiveness. And there's a specific component of St. John's wort called hyperforin, and that's believed to be the thing that does these things, so induces P-glycoprotein as well as the P450 enzymes. So this leads to a large number of interactions between St. John's wort and different medications. So I've listed many of them here. So St. John's wort's been found to weaken the effects of certain antidepressants, can weaken the effects of birth control pill. I even read that some birth control pills just simply don't work at all. So these are hormonal birth controls, may not work at all if taking St. John's wort. Cyclosporine, this is a drug that's used to prevent rejection of donated organs. There are other certain heart medications that can be affected. So digoxin and ivermectin, these are two medications that are typically used for heart failure. So the effectiveness of those can be reduced. Some HIV medications, their effectiveness can be reduced. Certain cancer medications, warfarin, which is a blood thinner. Some statins, which statins again are drugs that try to reduce cholesterol levels. Certain diabetes medications, the specific one I found was a drug called gliclazide, also known as Diamicron is its brand name. And there's also some anti-seizure medications that can be weakened by taking St. John's wort. So there's many different drug interactions that can happen here. Some other things, again, this was something that Julia talked about in her drug interactions talk. Serotonin syndrome, this is essentially where you get very high levels of serotonin in the body, and it can cause a number of symptoms. So there's a diagram here at the bottom just showing some of the different symptoms that you can experience with serotonin syndrome. And this is usually happening if you're mixing St. John's wort with an antidepressant that also elevates serotonin. So St. John's wort, one of the ways it's believed to work for depression is like an antidepressant in that it can elevate serotonin levels. So if you mix St. John's wort with another antidepressant that also elevates serotonin, or if there's another drug that has an effect of increasing serotonin, you can end up getting serotonin syndrome. And it can vary quite a lot as to how severe serotonin syndrome is. Some of them, you can get quite mild symptoms and you can get very severe symptoms. Showing here the serious complications include death even. In terms of side effects, there are several side effects of St. John's wort. So seems to increase sensitivity to sunlight, can cause insomnia, anxiety, dry mouth, dizziness, GI symptoms, fatigue, headache, sexual dysfunction, as well as if you use St. John's wort topically, you can get a rash with sun exposure sometimes. So there are many side effects to St. John's wort as well, even if you don't get those interactions with medications. It's also not recommended to use St. John's wort while pregnant or breastfeeding. In terms of pregnancy, it's because there's been some laboratory studies with animals where birth defects have been caused by St. John's wort or have occurred while the animals were being given St. John's wort. In terms of breastfeeding, it can cause colic, drowsiness, and fussiness in breastfeeding babies if the mother is taking St. John's wort. So just to summarize that there a little bit, there's quite a lot with St. John's wort. So St. John's wort definitely is something you need to speak with a healthcare provider before taking, because there are many interactions and negative things that can happen with it. All right, so the last thing we're going to be talking about here is ginkgo. So other common names, ginkgo has also been called fossil tree, maidenhair tree, so that was mentioned in the previous quiz there, like Japanese silver apricot, and those two names, I don't think I can pronounce them, so I won't try to. Ginkgo biloba is one of the oldest living tree species and has been used in both Chinese herbal medicine and in Europe for hundreds, if not thousands of years. There are several different uses or claims to what ginkgo can be used for. So anxiety, allergies, dementia, peripheral artery disease. So peripheral artery disease is basically when typically it's affecting the lower limbs, but you're getting buildup of plaque or atherosclerosis in your peripheral arteries. And this can cause a variety of symptoms. You may have heard of claudication, so where you get kind of typically it's with exercise or movement. Say you're going up a flight of stairs or something and you get some pain or cramping in your legs, and then if you kind of rub the area or just rest for a while, it'll go away. That's an example of claudication that can be due to peripheral artery disease. Tinnitus, which is just sort of the ringing that people can get in their ears. And there's various reasons as to why people can get tinnitus. Could be due to an infection, or could be due to just normal hearing loss, or maybe hearing loss from some other reason. So there's various reasons why you can have that. Also, it's been thought that it helps with memory and concentration, with mood, and Raynaud syndrome. So this picture here is just showing what Raynaud syndrome is. So what can happen, and there's various reasons as to why this can happen. It could be due to like stress or cold or various other things, but essentially you can get, your fingers can sort of turn white due to lack of blood flow. And this can happen in different, like it could happen in your toes as well, but a typical thing is in the hands. So it turns white due to lack of blood flow. Then as you get a lack of blood flow, you get a lack of oxygen to the tissues, so they turn blue, and then eventually the blood returns. And so what's happening is there's kind of this spasm of the blood vessels that sort of closes off blood flow. You get lack of oxygen, and then they open back up and you get the return of blood flow. And so that's when it turns kind of pinky red, and then eventually you'll get your normal skin color back. And there's many other uses for ginkgo. So in terms of the evidence around it, in general, the evidence is not conclusive as to whether ginkgo can really do any of these things. In terms of helping with dementia and cognitive decline, that's an interesting area for sure, but right now the evidence is inconclusive. In terms of anxiety, diabetic neuropathy, glaucoma, peripheral artery disease, premenstrual syndrome, schizophrenia, and vertigo, these are many things that have been studied that it's been found ginkgo might have some small effect, but again, not really conclusive that it does help. And then some other things that have been studied include memory enhancement, high blood pressure, tinnitus, multiple sclerosis, seasonal affective disorder, and trying to prevent heart attack or stroke. But for all of these things so far, the evidence has shown that ginkgo is not helpful in any of those. Again, ginkgo is generally considered to be safe, but it does have some drug interactions that are important to know about. It does increase bleeding risk. So again, you don't want to combine it with blood thinners, and you should stop using ginkgo before you have any sort of surgery. May also interfere with anti-seizure medications and increase the risk of having a seizure. So you really want to avoid mixing it with other medications that can cause seizures. And so a couple of common categories of drugs that can cause seizures are antidepressants and stimulants, such as cocaine or methamphetamines. Side effects can include headaches, stomach upset, dizziness, heart palpitations, constipation, or allergic skin reactions. In terms of use during pregnancy, it might be unsafe. There has been some evidence that has shown it might induce early labor. And again, because it does increase bleeding risk, it might increase bleeding at delivery. Safety during breastfeeding is not known. Direct contact with the pulp of the Ginkgo biloba tree seems to cause a reaction similar to poison ivy. So this is a photo of poison ivy rash. So apparently you get a similar sort of reaction if you come into contact with the pulp of the tree. And then there's a toxin in the seeds, as well as the unprocessed leaves of Ginkgo biloba called ginkgo toxin. So if you are consuming raw or roasted seeds or unprocessed leaves, you could be affected by the ginkgo toxin. It can cause a variety of things, such as seizures, vomiting, and loss of consciousness. So not pleasant things. Okay, so that's pretty much the end of my talk on all the herbal supplements that I wanted to talk about. I just have a couple of slides to sort of summarize the talk. This was a quote that I pulled from HealthLink BC just about some of the regulation around supplements. So it says that the makers of natural health products cannot legally say that natural health products can diagnose, cure, treat, or prevent disease, but they can say that they contribute to health maintenance and well-being. And I thought that was just sort of a good quote to sort of summarize the talk, in that there's a lot that we really don't know about herbal supplements, or a lot of supplements in general. So it's just important to be aware of that, that, you know, there's a lot of claims out there, but nothing is really definite right now with most of the supplements and the claims around the supplements. So definitely buyer beware. Again, I'm not here to shame you if you do take herbal supplements or any other supplements, and I'm not going to tell you you shouldn't take any of them. But just be aware that, you know, there's lots of claims, and not all of them are true, and a lot of them we just don't know yet if they are true. As well, some supplements are quite pricey. If you go to health food stores, you probably have found that some of the things that are there are very expensive. So just be aware of that not all the claims around them are necessarily true. And there's definitely a lot of research that needs to go on still. I mentioned again that Health Canada does regulate the products, and one of the things that you can do to try to make sure you're getting sort of the best natural health products that you can get is to look for products that have a natural product number. So this right here is an example of a natural product number. And then the other one is called the homeopathic medicine number. So this is just an example, another product here. So if you see this, it indicates that Health Canada has given an approval to that product and finds it to be safe and useful if you follow the directions on the package. Again, the regulations around these, although Health Canada has approved them, it's not the same level as regulation that goes into prescription medications. There's just simply not the same level of research and studies around these things. But if you are going to use any sort of supplements, do try to get ones that have these numbers on them, because that does seem to show that Health Canada seems to think that they are relatively safe if, again, you're following the directions on the package. So that's the end. I've got some resources here. HealthLink BC is a great resource as always. There's a couple of different sites from the NIH in the US. They have a long sort of data bank on all the different dietary supplements and some fact sheets on things. So those are good things to check out. As well, if you're interested in looking at interactions between drugs and supplements, drugs.com has a good interaction checker that you can use. And as always, if you're just sort of Googling things, Mayo Clinic and Cleveland Clinic, I find to be fairly trustworthy sources, and .gov.org websites tend to be a bit more trustworthy than your .coms or .cas most of the time. All right, that is all. Thank you for attending. This is our last talk of our current mini med school series. So thank you everyone for coming out to our talks. It's been a lot of fun. And if there's any questions, I'll just check the chat first.
Okay.
All right, yeah, Maureen, yeah, just saying she didn't know about, yeah, the NPNs. Okay, yeah.
Yeah,
Sorry, there's another question in the chat first. If we
Oh,
could just do that
sorry,
one
did I
first.
miss?
Yeah.
Oh, did I?
Yeah.
Okay.
Oh, yeah, sorry, I didn't see that. Can you comment on the efficacy of plant-based products in treating prostate enlargement? You know, this was something that I didn't look into, I believe. I think when I was researching, I found one thing that briefly mentioned it, but honestly, I can't remember which supplement it was of these ones that I saw something kind of mentioned briefly about it. So yeah, sorry, unfortunately, I can't really answer that question. I didn't see anything specifically in the research that I did, but there certainly could be some research out there about that.
Mm-hmm. Drew, I'm surprised to know, that places like India, there is a whole series of treatment and medical system or pharmaceutical system called Ayurveda. And a lot of people depend upon that, and through generations, they have treated a lot of diseases are under control or they prevented. Only recently, when the allelopathy became important, that people began to use. So there are other ways of treating human diseases like allelopathy, of course, Ayurveda, homeopathy. So what do you suggest? Do you suggest that a holistic approach combining all these system of medicine will be the best? Or if this is the case, why it's not done?
Yeah, I think, yeah, it's a great point. Definitely, I think a holistic approach is for sure important. I mentioned before, it's always important if we do have patients who use traditional medicines, we try to accommodate for that as best as we can. Again, we're more going to be prescribing the prescription medications or, sort of other approved over-the-counter products, but definitely if a patient doesn't want to do those things and wants to use traditional medicines, we try to accommodate for that as best as we can. Yeah, definitely there's lots of value in other forms of medicine. Western medicine isn't sort of like the be all and end all. There is a lot of value to other forms of medicine, but of course we always just want to be careful that when we are sort of mixing Western medicine with other medicines, we're not causing any harm to our patients. That's really, a big thing. We just want to make sure that we're not having interactions between a prescription medication and say an herbal supplement. So that's why we always want to ask our patients if they're taking anything other than prescription or over-the-counter medications, if they are using any supplements, because we do know there are negative interactions. So, but yeah, it's definitely a good point for sure.
Yeah, maybe, this is one of the reasons why allelopathy, has so much developed in the Western country, and is combined with the surgery also. So, otherwise the other medical system like Ayurveda, homeopathics, they are not so efficacious, so effective, no, immediately.
Mhm. Yeah. Sorry, I just saw Dr. Gair was mentioning palmetto for prostate, possibly. Okay, interesting. Yeah, it's definitely an interesting to look up for that for prostate cancer. I'm sure there is research out there about that.
Thank you very much.
All right, well, if there's no other questions, again, thank you all for coming out to our talk today. I hope you found it interesting. And yeah, again, if you are interested in getting the certificates